Hi everyone, today we're going to be going through the daily joint maintenance care routine for your lower body. So last week we sent out a video going through joint maintenance routine for the upper body, and so we're going to be finishing that off today. If you haven't checked that one out, you can check that out on any of our social media pages. So to start off with, we're going to start with our back once more. So we're going to look at the low back, but we're going to do kind of a global spine movement. So we're going to move from the neck all the way down. You can do this in a cat-camel position, basically meaning like on your hands and knees, or you can do this in a seated position as well. And so today I'm going to show you in the seated position. So you want to have a chair that's not limiting you too much, so you want to be able to sit a little bit far away from the backrest. From here, what we're going to do is we're going to start with you in a super rounded position. So you're going to let everything kind of flex, and you're going to let that lower back round, and then your whole spine is going to come down into that flexed position. Your chin can come towards your chest. From here, starting at your hips and your lower back, you can start to rotate through your pelvis. So you're going to start to have a little bit of an arch in your back, and you want to start to feel that bit of extension creep up vertebrae by vertebrae or joint by joint through your spine. And so thinking about each little joint going into extension one at a time, we're going to come up into a big back arch. And so up into the upper back, and we're going to come all the way up into your neck, eventually looking right up at the ceiling. Once you can't extend anymore, you're going to start to reverse that and go into flexion. So starting at my hips, I'm going to start to rotate my tailbone forward. My lower back starts to round. I'm going to try to hold everything else in as much extension as I can until it's its turn. And so slowly working my way up into the spine, everything is starting to move into that flexed position. And so finishing with my upper back and then my neck coming down towards my chest. Now everything's rounded. I'm going to do that once more. So rotating my pelvis forward, starting to feel that arch in my lower back. Feeling that extension creeping up joint by joint if you can. This gets a lot easier with practice. Sometimes it can feel really awkward the first couple times that you do it. But we want to be able to feel that little bit of extension through that entire spine. If there's certain areas you're maybe not feeling it as much as others, it might mean that you're a little bit stiffer there, or it might mean that you just need a little bit more practice being able to move through that area. And so that is a really nice and easy way to get some movement going through your whole spine. The next thing we're going to do is we're going to go down to the hips. So you can use the chair that you just used for balance, or you can use the wall for balance, just kind of something to hang on to a little bit. From here, we're going to make a really big joint circle. And so we don't want our lower back to move too much here. So one thing you can do is take a nice little deep breath in, blow out. You'll feel some of those muscles in your core activate, and so we want to be able to keep breathing in this position, but we also want to just keep a little bit of tension in that core. And from here, using whatever you're using for balance, you're going to start to lift one hip up as high as you can. So you want to bring that knee close to your chest, trying not to round too much through your back. Once it's up as high as you can, we start to bring that knee out to the side into abduction is what that's called. Once we get out to the side as far as you can, we're going to rotate the hip, and so the heel is going to come up towards the ceiling, and then that knee is going to start diving backwards into extension. You'll have to move around a little bit for balance sake, but we want to try to keep everything else as stable as you can. Once you're back to this normal position or the starting position, you're going to reverse it, and so you can bring that knee backwards. The knee is going to come out to the side, and you can start to rotate the opposite direction. So the heel is going to start to swing around. That knee comes forward, and then you can bring it back down into that starting position. Normally, I would maybe do 2 or 3 of those. For the sake of this video today, I'm just going to show you once on each side. You can either turn around or bring the object that you're using for a little bit of balance to the other side, and we'll do the same on the other hip. And so same thing, breathing in, breathing out, creating a little bit of tension in that core. We're going to start to bring that other knee up towards the chest. So we're bringing that up into flexion as much as we can. That starts to swing towards the outside into abduction. Once we're abducted as much as you can, the heel comes up towards the ceiling into internal rotation. You should be feeling all of that outside hip stuff working really hard. The knee comes back into extension and then down by the side. From here, we reverse, so that knee comes backwards, starts coming out to the side. We're squeezing all of that outside hip stuff. Heel swings around, comes forward. We're keeping that up as high as we can, and then it's going to come down towards the ground. And so same thing, I would do as many reps as you did on the other side with that other hip. Now moving down towards our knees, this can be a little bit of a funny position for people who haven't thought about the knee as being able to rotate before. So most people know that our knees can bend and extend, so it kind of moves as a hinge joint in that direction. A lot of people haven't considered that the knee also rotates. So in a bent position, the knee can actually externally rotate and internally rotate, meaning that this lower leg can rotate a little bit on the upper leg. So with this movement, we're really going to focus on maximizing that rotation. What you can do is you can take one arm and kind of wrap it around your thigh, and then the other arm is going to wrap on top. What we're doing is we're trying to lock that thigh in so that we're not getting compensation from our hip, and we're getting all of this movement from our knee. So from here, you can bend the knee a little bit, externally rotate it. So try to rotate that lower bone towards the outside, holding that rotation, extending through the knee as much as you can, rotating it inwards, bringing it down, and going through that a couple times, making the biggest circle you can from those knees. Reversing, so we did that one direction, we can also do that the other direction, maybe doing 3 or 4 reps, just trying to draw the biggest circle you can with your knee. We're going to do the same on the other side, so wrapping those arms around, trying to get as little movement as we can from the hip with this, rotating that to the outside, bringing it up, rotating it in, bringing it down, and going through that a couple of times here. And same thing, you can reverse on this side as well. Your ankle is going to want to come along for the ride a little bit here, and so you might feel some of those shin muscles working, but the big thing is trying to get as much movement as you can of that lower bone relative to the upper bone of your knee. For the ankles, we can do a very, very similar exercise. So it's basically drawing the biggest ankle circle that you can. Same thing here, as we're going through the ankle, we want to try to avoid getting any compensation from up the chain now. So from here, you can cross your leg over if you want, or whatever position feels good for you. But to start off, pointing the toes as much as you can. So trying to get a nice straight line through that ankle. Inverting, so bringing your toes kind of up and inside, starting to bring that foot up into dorsiflexion, and so that's bringing your toes towards your shin bone, rotating it around, bringing it down, and just making the biggest circle that you can in one direction, and then starting to rotate that the other direction. And so really drawing out that big, big, big circle. Once we've done a couple of that on one side, we'll do that same kind of thing on the other side. So just trying to keep things even. If you do have one side that you find is a little bit more difficult to control than the other, or you have one side that you're noticing feels stiffer, it's fine to do a couple of extra reps on that side and just focus a little bit more attention there. But we want to make sure that we're working each side a little bit. Once you have done the ankles, the last thing we're going to do today is a little bit of toe work. And so this can be really awkward and really uncomfortable to do for people who have never done this before. You can get cramps in your feet as well, but this is a really awesome way just to kind of wake up some of those little muscles in your feet. If you have issues with your feet going flat, or if you have foot pain or heel pain, these are great things to work on as well. So what we're going to try to do is we're going to try to lift the big toe independently from the little toes. So pushing your little toes into the ground, I want you to try to lift your big toe up. From there, if you can, you're going to push the big toe down into the ground and then lift the little toes off the ground. And you're going to try to push that as hard as you can. And then we'll go back and forth. We're going to maybe do even like 5 or 6 reps of this. Can be difficult if you've never done it before. It can be a big motor control and learning thing as well. But this is a great way of just getting connected with our feet first thing in the morning. And so that is kind of the daily maintenance routine for the joints in the lower body. Once again, we have the upper body in another video, and so if you want to check that out, you definitely can. These are exercises that we use frequently in the kin stretch classes that we're offering at the clinic, along with a lot of other really awesome exercises that are great for joint health, as well as improving your body's mobility and strength and body control. There's lots of great benefits that come from that. If you have more questions or you want more information on any of those classes, feel free to reach out to the clinic or myself.